Surgery. For stage 2 mesothelioma, surgery is usually considered if the tumor is located in one hemithorax, half of the chest, and has not spread to other areas. The main type of surgery for stage 2 is an extrapleural pneumonectomy, EPP. This is an aggressive surgery that removes the lining of the chest wall, the entire affected lung, the diaphragm, and parts of structures near the heart and large blood vessels in the chest. Sometimes nearby lymph nodes are also removed. EPP aims to remove all visible signs of the cancer, but it is a major operation that is difficult to recover from. Many surgeons now take a more conservative approach and only remove parts of the affected lung and surrounding tissues in a procedure called pleurectomy, decortication, PD. PD may provide similar survival benefits with less risks compared to EPP. Both EPP and PD are usually followed by chemotherapy and/or radiation therapy. For stage 2 mesothelioma patients who cannot undergo surgery, other options are considered. These include more limited surgeries such as biopsy to obtain a small sample of tumor tissue for testing. For some, limited resection of part of the lining of the lung or surrounding tissues may provide relief from symptoms like pain or breathing issues. Chemotherapy. For stage 2 mesothelioma, chemotherapy is usually part of the treatment plan whether given before or after surgery. The main goal of chemotherapy is to kill any remaining cancer cells that surgery could not remove. It may also be used to shrink a tumor ahead of surgery to make the operation easier. The most commonly used chemotherapy drugs for mesothelioma are pemetrexed, Alimta, cisplatin and carboplatin. These are often given in combinations or as part of multimodality therapy. Research studies have found that a combination of pemetrexed and cisplatin can provide the longest survival for stage 2 to 3 mesothelioma patients. Depending on the regimen, chemotherapy is administered through and for or orally in cycles usually lasting 3 to 4 weeks at a time. Common short-term side effects may include nausea, vomiting, fatigue, appetite loss, etc. Radiation therapy. For some stage 2 mesothelioma patients, radiation therapy may be recommended as part of the overall treatment plan. It uses high-energy rays or particles to kill cancer cells and shrink tumors. External beam radiation therapy focuses radiation on the chest area from a machine outside the body. This type is usually given daily sessions for a few weeks. Internal radiation therapy, also called brachytherapy, involves placing radioactive material inside the body, near the cancer. Radiation may be used after EPP surgery to further destroy any remaining cancer cells. It can also help relieve symptoms like pain from large tumors or relieve blockages. Side effects are usually mild to moderate and may include fatigue, skin irritation in the radiation area. Photodynamic therapy, PDT. This is a light-based therapy approved for use in selected mesothelioma patients in some countries including the United States. It involves injecting a light-sensitive drug called photosensitizer into the bloodstream which collects in cancer cells. A few days later, a special light is shined through small tubes inserted into the chest and the photosensitizer gets activated by the light energy to produce a toxic substance. This destroys nearby tumor cells by cutting off their blood supply. PDT aims to control disease and may help relieve pain or blockages caused by tumors near the lungs or heart. Potential side effects include skin sensitivity to light and pain at the tumor site during and after treatment. However, it does not cause significant long-term complications in most patients. Targeted therapy. Targeted drugs aim to interfere specifically with the mechanisms by which cancer grows, spreads and evades the immune system. For mesothelioma, anti-angiogenic targeted drugs are being studied. Angiogenesis refers to the formation of new blood vessels that help tumors grow. Drugs like bevacizumab may help block this process, thereby slowing tumor progression. Other targeted drugs under investigation include those that inhibit important tumor signaling pathways involved in mesothelioma growth. Immune checkpoint inhibitors also hold promise by helping unleash the body's own immune defenses against cancer cells. However, targeted therapies are still being improved and more research is needed to identify the drugs that work best for mesothelioma. They may be used in combination with chemotherapy or as maintenance therapy after initial therapy. HIPEC, this stands for hyperthermic intraperitoneal chemotherapy. It involves using heated chemotherapy drugs directly into the abdomen during surgery. The aim is to treat any microscopic spread of mesothelioma in the abdominal cavity that may not have been visible. It targets cells throughout the abdominal cavity that may not be reached by intravenous chemotherapy alone. Thus, it may help control disease more effectively. However, it requires a major operation and specialized expertise to perform. Not all centers offer this treatment, and further research is still evaluating the safety and survival benefits of HIPEC for mesothelioma. It tends to be reserved for stage 2 patients after EPP surgery as part of their multimodality treatment plan. Clinical trials. For stage 2 mesothelioma, participation in clinical trials for new therapies is strongly recommended whenever possible, as it provides access to the latest treatments. Trials evaluate new chemotherapy or targeted drug combinations, immunotherapy, vaccines, and other experimental approaches that may work better than current standard options. This helps gather data on safety and effectiveness to potentially change future treatment standards. It offers patients the best currently available treatment while also contributing to new discoveries. Risks and benefits should be discussed with doctors to help choose suitable trial opportunities. The treatment options for stage 2 mesothelioma aim to remove detectable cancer using aggressive EPP surgery combined with chemotherapy and sometimes radiation. Limited surgeries, targeted therapies, immunotherapy, and participation in clinical trials are also considered in multimodality approaches to maximize disease control and prolong survival for stage 2 mesothelioma patients. Treatment plans are tailored based on individual health factors and tumor characteristics under the guidance of a multidisciplinary mesothelioma care team.